Folks, thanks for joining us today. My name's John Dubas with Premier Marketing. We'll be spending the next hour or so giving an overview on one of the basic needs of an insurance agent working in a particular segment of the insurance world, the Medicare market, the base information that's needed to properly relay information and make choices available to the population that we serve. It also serves as a great way for us to make certain that we're up to date in our information when it comes to this market and make us realize that this is a great topic to use in the community, either virtually or in reality. And that's what we'll touch on today. You'll notice in the software package, there's a section for both questions and chat. We ask that you put your questions in the questions box. We find that we normally cover most of them through the course of the presentation, but we will check to make certain that we address any pieces of information you need to get full value out of today's presentation. It is being recorded, this presentation, and will be made available on our website at premiersmi.com and on our YouTube channel as well. We do direct these presentations to a variety of agents with experience. And so some might appear a bit remedial to some maybe not. Some it's a great review, but we look to get the information to as wide a spectrum of agents as possible. So hence the presentation in its present form. We usually start with a little bit of level set as to who Premier Marketing is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states. We act as an insurance wholesaler working through independent insurance agents such as yourself through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. And we do so through a full portfolio of products aimed at our target market. And that includes the base medical programs under Medicare, the Medicare Advantage and Medicare Supplement programs, and the standalone Part D prescription drug plans, but also a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits that address the specific needs of the population we encounter that need help in specific areas. We do this sort of portfolio marketing because it does apply to the Medicare population across the board, or will very shortly. And that's important for us to address because when we look at some of the specifics in the program, these are choices that come to fore when we speak to education on Medicare programs and how they can affect people in specific markets. So in the Medicare Advantage world, you've got the national carriers that are there for you, along with many of the strong regionals that make a difference in specific markets, with that same philosophy carrying over to the standalone prescription drug plans, those PDP programs. And you'll notice that the bulk of these come as an adjunct, an ancillary to the contracts that you have for the Medicare Advantage products, with a couple of exceptions. The Mutual of Omaha program is their PDP program specific contract, and Clever RX is a discount program and not an accredited standalone Part D program. We look to make certain that we're able to help people regardless of their economic status or their mindset when they become a Medicare beneficiary. So we want to have all the choices out there for the base coverages, and that includes a strong portfolio of Medicare supplement products. And because of the way that our programs are set up, we have specific programs to help you be successful in this space in marketing to this segment of the population. Same mindset with ancillary products, except these programs aren't subject to some of the same marketing oversight. Doesn't mean you want to go on TV and mix a bunch of products together and propose that it's a single product, but in each of these areas, we have the national carriers there for you as well, and they serve a specific need for the population we serve. In addition, it does give us that additional marketing leverage, and it creates an additional revenue stream for our agencies, which is, of course, very important. We look at the Medicare market overall. Yeah, you hear the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. And when you look at people aging into Medicare, it seems like near exponential growth. But because of some other pressures, put upon us in our society. For someone to get full Social Security, they got to work for 67 if you're at the tail end of baby boomers and beyond. And there are people that just choose to work past 65 and don't access all of their Medicare benefits when they're first eligible. You have a smaller number, in a manner of speaking, there when you look at total number of people on Medicare based on age. You have to factor in the fact that there's a good percentage of people on Medicare that are under the age of 65 accessing Medicare benefits because of disability. They need our help, especially as well. And so being familiar with the basis of Medicare, how it affects the population overall, how certain segments of folks accessing that benefit have different opportunities than others, we want to make certain that we're able then to address whatever choice is necessary to cover people on Medicare, because they don't have to do anything. They can actually decline the Part B, as many of you are aware, for one reason or another. Some might look at it just as a cost. Some might say, well, I don't need to. I have coverage through work, whatever reason. Doesn't happen too often, but there are some folks too that will have Medicare A and B and self-insure for the medical cost shortfall in that program and pick up a standalone Part D plan to help with the cost of medications. Those same people may be the folks that are taking on a standardized, modernized Medicare supplement plan to address the medical cost and then pick up that Part D plan to help with the medications. And then you have the folks that are accessing the bundling of the benefits through the Part C programs, the Medicare Advantage plans. In each of these areas, there are valid choices for people on Medicare dependent upon their circumstances. So we need to make certain that we have an idea of who we're speaking with and the choices that they have based on different pieces of information that are revealed as we speak to them. Because when someone's first coming on Medicare, well, it's been a pretty even split on the base medical programs between MA, Medicare Advantage, and Med-Sup programs, the Medicare supplement programs. The last 3 or 4 years, it's tweaked a wee bit where we're seeing these numbers flip-flop a little, where Medicare Advantage is a very hot product. But this tells us we need to be prepared once again for each of those choices. And in order to do so, we need to be familiar with what Medicare is and what it is not. And we need to be aware of the fact that this might be a bit of a repetitious process, because some folks, even though they really, really need to, do not review their programs year over year. This is a bad thing and this is a good thing, depending upon the viewpoint. Bad in the fact that, boy, it's going to cost a whole bunch of people, about 70% of the Medicare population, the opportunity to look at programs that might have more complete coverage or coverage at a lesser cost, or for whatever reason, they need to check because circumstances change. For us as agents, that's telling us that the majority of people on Medicare need our help year over year. So it's not just the folks that are new to Medicare or turning 65 that need assistance throughout the year during a lock-in period. There's a good portion of the Medicare population, now over 66 million of them, that need our help throughout the year as well. Because it doesn't matter what their base coverage is, they're not looking to do that plan comparison simply because, well, whatever reason it is, we're content. It worked for me last year, that sort of thing. Being aware of those circumstances and how they change can make a huge difference. And we'll touch upon that in just a moment as well. And we'll also touch upon the fact right now that we need to translate some things. Medicare has its own language, a ton of different acronyms, and it can be confusing to a whole lot of people, including some agents. So what can we use as a guide to help us define what SEP means, OEP, what's the difference between that and AEP and all these other acronyms? Well, this page on the CMS website tells us that we have a definition guide for 4,420 of them. So there's a whole bunch out of there. How can we make certain the information that we're sharing with our prospects, our clients, is not only valid, but understandable? And utilizing these programs or utilizing these acronyms, these pieces of communication, that might just confuse the the topic in a manner of speaking, and we want to make certain we're able to spell out what they need, and in certain circumstances, if necessary, avoid the use in order to properly communicate what's going on. Because folks aren't using what the government's put out there, be it online, whatever else, the 800 number, the Medicare New Book that they get every year. No, not examined. Plus, the early version doesn't have the next year's numbers in it anyway. The information that's available online, we're seeing a population that is grasping and taking into themselves the ability to pull information offline, but not heavily utilized. The information that's on the internet, not heavily utilized. So how can we deliver that information? That's by being organized, trained, and ready to deliver in the fashion people want it delivered. So that might be sitting across the kitchen table, shaking hands and kissing babies, doing some things in person. A larger and larger percentage of the population, however, want to garner that information virtually. Can we deliver it in that fashion? And then, of course, you get the hybrids where we've got to go back and forth. All that said and done, you got people that are much more adept at assimilating the information in this fashion, been trained over the pandemic by doctors, by specialists, by hospitals, by dentists, by factors in our life, faith-based organizations. So we've got a population that is much more comfortable in assimilating that information in that fashion, and it gives us as agents an opportunity to make certain that our most valuable resource, our time, is handled properly as well. A great way for us to ride the crest of this information dissemination. And we have to do so in a fashion that coincides with the regulations the government gives us. Medicare, on a base program, has timelines on just about everything. And for folks that are already on Medicare, we have the standard election periods. The annual election period, which ends on Pearl Harbor Day, the open enrollment period, which is available but not available to market as agents. Well, it's right out there as well, and we're in the midst of that at the time of this recording, the first part of it. So knowing what we can and can't do based on these regulations are important, but we have to make certain that the time period we're currently in, the open enrollment period, we realize that that is basically an opportunity for folks that have selected the Medicare Advantage programs, an opportunity to do a one-time election and change within that system, or go back to original Medicare, pick up a Part D should they choose to do so, and take care of things in that fashion. We, however, have to be careful as to how we market this, because we can't market it. We just need to be aware of how it can be used, and then be cognizant of the fact that there are a ton of what I'm going to call standardized special election periods that apply year over year, and the bulk of the people on Medicare normally, well, they qualify for one or the other. So it gives us that opportunity to make certain that in our discussions with folks, we not only are able to relay information, but we're able to affect change as well, because there's even special election periods. The carriers are really good about making certain that we understand updates in those opportunities. So we look at all this background information and we speak to, how does this affect Medicare, our marketing of it, moving forward, and how we can use those different constraints, in a manner of speaking, that are placed upon us to our advantage. Because, well, if you work a system, this is one that gives you the data on the base part of it, and as long as we follow the rules and regulations, can be very, very, very rewarding for folks that concentrate in this area as well. So as we go back to basics and we look at Medicare 101, let's look at the fact that a whole bunch of the information we need to study year in, year out is in that periodical, available to anyone, Social Security offices, online, to the Medicare population, either mailed to them through the Postal Service or delivered electronically. This gives us information as to what Medicare covers and what it does not, and keeps us current, because it is reissued each and every year. And we realize that there's a lot of changes on Medicare that go back to 1965, when Lyndon Baines Johnson signed Medicare legislation into law. which was basically a skeleton of what it is now. A lot of changes have come about since that point in time. And because of different financial challenges, pressures put upon this segment of the market by the number of people coming into eligibility, change is inevitable. We just need to make certain we have the basic information available for ourselves and make certain, too, that we're able to properly relay that information. Because, like the first Medicare recipient, Harry S. Truman, give him hell, Harry, we need to make certain they understand what's going on and how different coverages and issues come into play. Because it was initially initiated as a program for folks 65 or older, regardless of income, medical history, or health status. It was expanded in 72 to cover certain people under the age of 65 with long-term disability. Hence the graphic we saw earlier with the sheer numbers of people based on age, and then the folks that access the program because of those disabilities. And it makes a huge role, plays a huge role in the stability of a person financially and their ability to address care when it is necessary. It's also important to note that this is a huge monster when it comes to monies. If we go back 5-6 years, Medicare spending accounted for 15% of the total federal spending and 20% of the total national health spending. So we're talking about a population that utilizes services and it comes at an expense. And it needs translation because, gee, what's laid out there, some folks don't realize what they have and what they haven't until they go to use it. So we look at the fact that most folks age 65 or older that are entitled to Medicare Part A, they have it if they or a spouse are eligible for Social Security payments, and they don't have to pay a premium for Part A if they pay payroll taxes for 10 or more years. So we're looking at a segment of the population that has been part of the workforce. When you look at the people that are accessing Medicare under the age of 65 because of disability, in most cases, they've gone through a 2-year waiting period for most illnesses, with an exception of end-stage renal folks, ESRD people, and the folks that fight Lou Gehrig's, amyotrophic lateral sclerosis, ALS, where in those circumstances, folks that are disabled because of those physical maladies don't have that 2-year waiting period. For those that are 65, this can be a bit of an interesting conundrum for folks as to, well, how do I get it started? How do I pay for it? What do I pay for it? Things of that nature. The government does a pretty good job at communicating with folks that are coming into eligibility, but it's not something that a Medicare recipient can depend upon. They need to be on top of it and reach out and do certain things, either in person or in line, to make certain that those coverages are there in place for them when they're first eligible, because there are penalties for late enrollment in many circumstances. And we want to make certain then that there's no lapse in coverages as well. When we look at a system now that has an under 65 population that ages into Medicare a bit differently than what we've had in the past, there's also the question of how do we handle people coming from the marketplace to Medicare. We have a separate presentation that helps illuminate that topic. Things for us as a Medicare agent, we've got to consider that there are, in essence, 2 categories of coverages. We talked about folks not doing anything, so we take them out of the equation. But the options that they have are to stay in traditional Medicare and either self-insure or pick up coverages for the shortfall through traditional Medicare coverage and the med subs and bring in then the PDPs on it. Or are they going to go the bundling route of Medicare Advantage and prescription drug plans? I'm not here today to argue the value or an opinion on one or the other, because I think each has their place. But at this point in time, we need to be aware of the fact that folks have these options and that certain components within that, the choices that they have, well, we as agents have to act differently because we offer them. We have seen recent regulations that come into play, part of it as a backlash to people who are advertising in a, finger quotes working here, creative fashion, that have brought about different requirements for us as agents as to how we can pursue this or the dissemination of this information. So Medicare supplement plans have different oversight on them, compliance oversights than the MA programs, and different regulations as to how we can market one or the other. It also affects our commissions because the max commission on a Medicare Advantage and PDP program is set by the government. That makes a difference. The two choices also have different enrollment periods that will come into play because one may be subject to medical underwriting. The Medicare Advantage plans are not. They have, well, they used to have back in the old days, 2 medical questions. Don't have them any longer unless someone's looking perhaps at a dual special needs plans. There's also then those enrollment periods that apply to the enrollment in an MA or a PDP program, but it does affect our marketing of Medicare supplement plans because that person may be in an MA plan and we look to change that coverage in the best interest of our client. And can they do it? Because it's not only locked out, it's locked in, whatever you want to put it, because folks, if they've made that choice and they don't qualify for one of those special election periods, it affects how we market med subs as well. Then, of course, too, there's the requirements to offer the programs. The licensing and certification is different for one option versus the other. There's only one Medicare supplement program that I am aware of that requires certification. None of the others do. All of the Medicare Advantage and prescription drug programs are subject to annual certification. And the degree and process to which that is made up, well, that will vary according to the requirements of a certain carrier as to their specific process to address that requirement. And so we need to be aware of what we're doing in those circumstances. When you look at the basics, the ABCs of Medicare coverage, we're looking at different segments that come into play, a lot of it based on when they were enacted by the government as to what is covered through what part. So Part A, overly simplified, covers inpatient hospital stays, skilled nursing facility stays, and some home visits and hospice care. It also requires co-insurance for these coverages if you're going with just traditional Medicare, along with a deductible. The Part B coverage covers physician visits, outpatient services, preventative services, and some home health care visits. These are subject to an annual deductible, and co-insurance. So we want to make certain that we are aware of what covers what, and that folks realize that there are premiums that are involved in most circumstances for these, in addition to that out-of-pocket exposure. When you look at Medicare Part C, that is a generalization of the Medicare Advantage programs, which have been around for quite some time now, but are delivered through private organizations based on a healthcare delivery system that will vary according to the platform they use to deliver that care. And by that, I mean, it might be an HMO, it might be a PPO, it might be a POS, it might be a number of acronyms that will tell us, is that based on a hard network, one that allows some coverages when they go out of network, and how that is covered in that manner. You also have to realize that Part C programs normally integrate in the Part D benefit, the next letter in the alphabet that we deal with, and that are the drug plans. The majority of the Medicare Advantage programs are Medicare Advantage prescription drug plans, where that drug coverage is integrated into a singular benefit, and selection of the health plan is also the selection of that drug coverage as well. I lay that out and put it subject to that white light simply because some people will think, well, I can put them in an MA plan that doesn't have drug coverage and add a standalone Part D on it. Vast majority of programs don't allow that. There are certain PFFS plans, private fee-for-service programs, that are hard to find now that might be the circumstance, but generally the standalone Part D programs are for folks that are self-insuring on the medical portion of it, or they have picked up a Medicare supplement plan and need help with the cost of the medications. This is important to know too, that this is subject to the same regulations that we see on the Medicare Advantage programs, the timing of the enrollments, the changes that can be made and when, and how changes within that program can occur as well. So these programs, the Part D programs, are one of the main reasons, not only the Part D program, but the integrated drug benefit, as to why someone needs to do an annual review, because these change. The formularies, the drug list, that's part of the coverage of these programs. What tiers these drugs are covered on. So what does the out-of-pocket cost within that system? Are there step therapies involved? Are there limits as to the number of pieces of medication that can be set out? So there are different things that we need to be really aware of as to how we go about explaining Part D coverages. That will, in many cases, then bring about a discussion of, boy, I can't afford those drugs. Are there any assistance programs? They are outside of a true ABC of Medicare coverage, but knowing about LIS, 3 more letters in the government's vernacular of low income subsidy or extra help programs that affect the cost of medication coverage, can make a big difference. So we need to be aware of not only the things that are ingrained in coverage on the Medicare program itself, but how we can affect those coverages through other options that people have when it comes to coverage. Keep going back and forth on these, as well as to, well, how do we address the gaps in the basic programs then? Because there are deductibles on both parts A and B, and there are, in most circumstances, coinsurance that goes along with them. Medicare itself, traditional Medicare, does not have a cost out-of-pocket spending limit. And many folks don't realize that accessing the same service, depending upon the timing, may require additional out-of-pocket expenditure. And then, of course, there's always the portion of needed services that aren't covered by original Medicare that people don't realize, well, they're not. So it's the old what Medicare doesn't coverage. We have another webinar on that as well to specifically address those issues. We look at how these programs are paid. It's a monster of a program, and so they collect the monies to fund this service in different ways. Part A is funded by a 2.9% payroll tax on earnings paid by the employers and employees. So it's a split down the middle match. That's put in a trust fund. And for folks that are of higher income, the monies that they're paying can be higher as well. And we want to make certain that folks realize that when it comes to the second portion, the doctor's coverage, if we're going to overly simplify it, that speaks to how these are covered. Well, there's a lot of talk each and every year as to what the Part B premium is going to be. Last year, wow, we say that now that it's 2023, the Part B premium was actually higher than it is this year. A lot of that was pointed at one particular medication that really greatly influenced the cost across the board. This monthly premium can be affected not only by when a person enrolls, because there are late penalties that come into play, but also what is the income of that individual or married household, because that will affect the monies that come out of an individual's pocket. I have a friend at one point in time, a number of years ago, say, "Gee, John, look at this. Look at how much I'm spending for Part B. I don't understand this." And my response was, "Well, you're blessed. That means you made a lot of money, or you're making a lot of money, and it's affecting the premiums that you pay for that Part B coverage, which, even at the maximum premium that's collected, is a very, very good deal, if you want to put it that way, as to the cost of the program itself." This addresses that IRMA legislation, where people that are of higher income, what do they pay as to a monthly premium for Part B coverage alone? Now, keep in mind, IRMA also affects the premiums that are paid on drug coverages. So if an individual enrolls in a Part D program and they're of high income, they're going to pay more as a surcharge on their drug coverage as well. And if they're in a Medicare Advantage plan, that same circumstance may come into play as well. So we got to make certain that we realize that people that are of high income are going to pay more for their Medicare contribution than folks that aren't as fortunate monetarily. Now, keep in mind, this is a pretty small percentage of the Medicare population, but for agents that pursue people in this niche, you're going to run across it. And so you're going to need to know why these people are paying more, where the person you just met right down the road in a much less affluent area or circumstance, they don't have that same kind of financial exposure on the basic contribution. This is why. When we look at Medicare Part C programs, these are a bundling of the benefits altogether. A person does not give up their Medicare benefits to join a Part D plan. They are, however, assigning the administration of those benefits to that private insurer who's been vetted by the government, contracted, and approved in certain areas to operate. It also is a situation where those benefits have to be approved by the government through a filing each and every year. This is the program you see beaten to death on television on commercials. For a person, however, to be eligible for these plans, they have certain base requirements, and that includes continuing their traditional Part B coverage, because without Parts A and B, an individual does not qualify for a Part C plan. We look at the drug coverages. Well, there's a whole bunch of companies out there offering these programs. The bulk of them are really dominated by a few number of individuals. But how a company addresses and presents these benefits through a standalone Part D program, a lot of it goes to philosophy and dollars and cents, plain and simple. So we want to make certain that if folks are in a particular drug plan, it not only has the drugs they need at a means in which they can afford it, but also in certain circumstances in a plan at a premium that is at the median benchmark of plans. Because if they're lower income and they select a plan under that benchmark, it can really affect them positively on a financial basis. That low income subsidy program that I referenced before, well, it may not only take care of the premium of the plan itself, but will affect the coverages within when it comes to dollars and cents. It doesn't affect the makeup of the plan. Formulary is the same, procedures are the same. What a person pays for different medications is what makes a difference. And we want to make certain then that people realize that there are reasons why plans are priced as they are. A plan with the least expensive Medicare coverage premium for the drug benefit may not be their best buy based on the medications that they take. So we need to look at what a person is getting for those programs. When Part D first rolled out, my father wasn't on a single medication, had been on Medicare for a number of years, took out the least expensive plan available in his neck of the woods because he didn't want the penalty. Makes sense. And you have coverage should circumstances change. For Dad, it did. By the end of the year, he was on 6 meds and he actually needed the coverage. But that's the thing with insurance. You take it out because you don't know what's going to happen. And you can only base the choice based on current circumstances or something that is logically forecastable. Put it that way. We know this is going to happen. How do you know? Well, I got a family history, whatever. This, however, tells us that we need to make certain coverages in play, and we do an analysis regardless of an individual circumstance at that point in time. So we want to make certain that when we go to leverage the Medicare market, when we're looking at the basics on how to get into this, that we are prepared to do so. We've done our reading and our studies. We've translated the language that's out there. We've practiced our approach. We are targeting a segment of the population that fits the products we offer, because you don't have to offer everything that's out there. Generally, we consider that a good idea, but you have agents that are proponents of one coverage or another based on their personal experience. Sometimes you got to set that aside, be aware of all the possibilities, and if you're looking for something that coincides with your mindset, well, target that population that's the best prospect for that. and do so in a fashion that allows you to contract ahead of time, because the requirements are different. Remember, if it's a med sup versus an MA plan, and then we leverage that information across the board, not only with the contracting hierarchy, but also with the carriers that are offering the products that are part of our offering to the Medicare population. Because once again, the government will help train us too. Some of these can be pretty dry. Some of them are really kind of interesting when you get into the trainings that CMS does on their own. But it's also then a location where we can garner the information we need to spread our gospel, because they are a source of Medicare 101 presentations that are already set, or a presentation on drug coverage on Part D plans, or on med subs, or on MA programs. So it's a great way for you to have a repertoire of presentations and utilize them either virtually or live, or for ourselves to make certain that we understand differences as well. There are, of course, too, the different pieces I alluded to earlier that the government has put out there that are really, really good, but really, really underutilized. Notice this particular piece. It's 3.5 minutes long, which generally, the mind can absorb what the butt can endure, kind of speaking. Ironic that I say that. But it's been on display, so to speak, for 8 years, and there's less than 1 million views on a really short, really nice piece. Part of it might be because people don't realize it's out there, but for us, it's an indicator that people aren't necessarily picking up all the information they need to make those choices. So let's look too at the national training program that the government offers and pull those modules that help us present. Attend some of the webinars that they do to address specific issues. And it gives us then a way of expanding our knowledge base, becoming much more comfortable in what we know and what we say, and of course, give us just the facts, ma'am, like the old TV series a long time ago used to say. So some of those presentations, now these are snapshots from some time ago, so the covers may be changed, but you'll look at, these are topics that are available through that training council that help us in our presentations to the public. So a general piece on Medicare, getting started, making certain that folks understand what a Medicare Advantage and other Medicare health plans are, not a gobbled up, stuck together presentation that garners a phone call into a call center. This is intended to give them the information as to this is how these plans operate. And these are how Medicare supplement programs offer, and how they are standardized, and how they are offered, and how you can or perhaps cannot pick up one of these types of coverages depending upon where you are throughout the year. Same sort of thing when we talk about prescription drug coverages. So you have also, in addition to the government information, the carriers with whom you contract that will give out great ways for you to follow a presentation, do so compliantly, and in most circumstances, they deliver it to you without cost. These are as well, but the plans that you work with, well, how you market depends upon your mindset and what you have put into play as part of your marketing plan. If you're doing some things on a more generic basis with information that's procured from the government itself, you have different filing obligations that can come into play, but you also have different support that may or may not be there by the carriers with whom you partner. So if you're utilizing information that they're kicking out, they may well have marketing dollars to help you with these explanations. United Healthcare has a wonderful series on Medicare Made Clear, the different guides that they have that are available, and these publications in tactile form. What do you mean, John? Well, you can order them and you can hand them out at the meetings that you're doing on a live basis, or download them and make them available virtually, I should say, to the folks that are part of your webinar. A number of these guides are available. They have different limits as to how many you can order, of course, but the cost is not there. Other carriers come across with some of this information too. This isn't meant as a commercial for United Healthcare. If I'm going to say there are a number of MA companies that can help you in this regard. Aetna has a great series on Medicare 101. You have different pieces that are available through Anthem, Elevance, um, um, AmeriGroup, whatever you want to utilize as the labeling for this particular organization in your area. So different topics can be made available as well there. And you'll see that some of the other carriers that are making an attempt to be a bigger influence in a market, they have material available as well. And it goes beyond just what you can pull off of an internet site. You have the people that are in play in those different areas that can make a difference for you. Depending upon your market, this is a great way for you to not only utilize the information that's already there, because you don't want to reinvent the wheel. You want to go through the approval process on this. Somebody's already done it. That's awesome. Let's use that. But it's a great way for you to develop a relationship with the agent managers of these different carriers in the different markets that are out there, because some might have one for a particular product and another one for another product. Not as often anymore, but that's a great way for you to enhance that relationship and make certain that you're delivering information based on, well, guidelines that these plans have put in play for you. It's not meant to constrict you. It's meant to help you walk down that path, say the right things at the right time. And, it's like I said, you deal with any of the major carriers, they're going to have support material like this for you. And sometimes it's just going on their agent site and browsing and finding it, or reaching out to the agent manager with that company and say, hey, this is what I'm looking to do. What have you got to help me? Or obviously going to your contracting hierarchy and say, hey, I want to work the dual special needs arena. What carriers give me some help, and how can I go about becoming proficient in the offering of those services in my markets? You even have, of course, information we deliver too through our association with the Integrity Marketing Platform. We've got a ton of material out there that can really help you in this regard as well. So we have to be aware of not only the basics of the programs, the material that helps us market, but then when you come across certain individuals that have certain circumstances, how can we deal with them? Well, we reference back the material I just talked about, but we also want to be aware of the fact that some people may be exercising individual coverage through the marketplace. And then because there are similarities in how the programs are set up on a base level, how do they interact, or do they? Or how do we switch someone from one coverage or another? You'll find that as people age into Medicare, some of their options on the marketplace, well, they just go away. How can we address those circumstances? We've got some presentations that can help you specifically there as well. It is important to note Medicare isn't part of the marketplace, and the enrollment periods are a bit different when it comes to the time period in which a person can select coverage, if they're going through the Medicare market or if they're going through the marketplace itself. And a lot of that is dictated, overly generalized here, by age and that base coverage that they have in play. Government does put out a ton of information that can help you in these different areas. Reference material that you can go to that not only give you the information you need to address specific questions, but also information that can be a source of validity for you in your presentations, by, of course, not only pulling the information you need from these sites, but making available these sites to the folks you're visiting with. It's validity of your information that's out there. And then how can we utilize this to the best advantage of the folks that we're working with? Once again, this is an area the government puts out that many agents aren't aware of, where there are resources available through a government site that addresses specifics that can be much like what I referenced earlier with United Healthcare and their Medicare Made Clear series, or or Humana or Anthem or whomever it is that have different programs that can help you with publications. This is another area you can go to and access information with certain quantity limits without cost from the government itself. And sometimes folks don't realize that that's there for you. We've got a recording guide for this as well that can be very helpful for you. And I don't mean to seem like we're bouncing over particular topics really quickly, but we are, because there's a whole bunch of stuff we need to present. And each of these you can spend an hour on all by itself. When we look at Medicare supplement plans as an option, however, we need to be aware of when a person got their base medical coverages under Medicare, because that determines what med sup versions that person's eligible for. Macro legislation changed things for people that came on Medicare after the 1st of January in 2020. A couple plans that aren't available to that population. For folks that had already been on Medicare, well, it's still there for them. So that can affect how we market to the population as well. I speak a lot when we talk about how do you pursue people in the Medicare supplement market. Base it on age. You know, you got the everybody wants a piece of that T65 business. Some people, however, will chase the 66 and 67-year-olds because their premium changes. But we need to be aware of the fact that a 67-year-old at this point in time, well, they don't have that C and F option. So depending upon the programs that we're working with, the carriers that we're working with, that may well affect our target audience, plain and simple, because some may not be eligible for some of the programs that we offer. And are we adept enough to recognize that and then pivot to coverages that do apply in their circumstances? Because when a person goes to buy a med sup, well, they got different time periods in which they can do so without underwriting. And based upon the state of residence in certain circumstances, they may be also eligible for a anniversary period in the month in which they took out the program, where they don't have to go through underwriting. Or that state may have a birthday rule that in the month of that person's 60 or their birthday, they can change coverage without undergoing medical underwriting. It's important for us to note, however, that these time periods do have some effect on us when it comes to our bottom line. Obviously, we want to take care of our prospects and clients. We also have to realize that certain companies offering Medicare supplement plans, well, it affects the commission that's paid on those plans as well. You got to do what's right, but you also need to make certain that you're doing what's right for all involved when we come to those opportunities. There are still certain plans out there that are Medicare Select plans. They're Medicare supplement programs where the coverages for the hospitalization may be based on one particular facility or chain of facilities when it comes to hospitals. You don't see those nearly as much anymore, but they are still out there, and we want to make you aware of them when you look at some of the basics on how Medicare is affected by other plan choices down the road. You have, of course, that 30-day free look period. And at this point in time in January, we have a lot of agents that are dealing with people that may have changed into a different Medicare Advantage plan or to a Medicare Advantage plan from just traditional Medicare or Med Sup. Are they comfortable with that? How do we make certain that they stay in a program that is best for them based on their judgment? And sometimes that means we need to take advantage of that 30-day free look period with the Medigap programs. You'll notice too, as I mentioned, part of how we target our marketing based on our knowledge of 101, Medicare 101, well, sometimes that means you want to market Medicare supplement plans. We want to make certain that we're able to target folks that can afford the premium. That is a huge draw for Medicare Advantage plans. Many of the no additional premium required plans, or even what we call the give back or buyback benefit that many of the commercials speak of, those aren't part of a Med Sup offering. But we're also looking and realizing that the folks that normally buy a Med Sup tend to be a tad more affluent because they have to be able to afford it, and they are looking to avoid any type of network constraint that may come into play. So that can affect how we reach out to the Medicare population and the segment of which that we work with year over year. Because, as I mentioned before, there are programs we need to make certain that people are aware that we offer that are outside of some of the traditional Medicare coverages. Medicare A and B doesn't help them with drugs, except for some things that are delivered as Part B benefit. But if they're looking for a prescription through a pharmacy, that's a separate program. That's where we come into play. If the folks are recently retired and they look to travel, we need to make certain they realize what is and isn't covered outside of the United States. And a key component and a very expensive part of an overall financial planning program through retirement deal with long and short-term care programs. Well, how does government cover those? In most cases with Medicare, they don't. There are coverages within the Medicare program, the SNF benefits, that a person can go into a skilled nursing facility. That's that acronym, after a 3-day stay. That's being addressed too. But how then do different people use that recovery period, in a manner of speaking, to work in conjunction with long and short-term care programs? We got some really sharp people within our organization that can help you in that regard. And then, of course, a lot of people, it's the old Tony Randall line, and part of the pitch on some of the publication we go out there with the word assume. Some people think that dental is going to be covered once they get on Medicare. There's a big surprise coming for folks. And some folks will feel that, okay, there are vision benefits that are covered by Medicare. And that's true to a degree if it's an eye health issue. If it's a standard exam and regular glasses or contacts, no. So we need to make certain that people are aware of that and that we have means to help them in that regard. Same way with hearing. No more hearing loss. The exam's not even covered under original Medicare, let alone look for help and the cost of a hearing aid. We have programs in each of these areas. We as independent insurance agents, not just we as Premier Marketing employees or folks affiliated with that system. You have options to help people in each of those areas, and it helps us overall as well, because the more programs that we have in a household, the better our persistency is. We retain more people in our book of business, the more product that we have in the house. Doesn't have to be with the same company, it has to be with the same agent, and that's you. So that can make a big difference as to how you realize that, well, one size doesn't fit all, so there's not a standard benefit package necessarily, without looking at circumstances of an individual, and we can't put all of our eggs in one basket if we look to remain active and successful in this niche. So we got to be prepared with the differences between a Med Sup and a Medicare Advantage plan, and help people be educated as to what may well be their best option. And a lot of this depends upon that individual. I saw a study here recently that said most people will read a study that agrees to what they think. It reinforces their mindset as to what is best for them. Having an opportunity to address basic coverage challenges, basic coverage benefits, based on the routes that a person can take, well, that can really influence that decision. Because in the end, what's the most effective plan for someone? The one that's in play when they need it. It's much like life insurance. What's the best type of life insurance? One that's there when you go to claim on it, in a manner of speaking. And that's the same way that our folks that we visit with have when it comes to the choices they have for their coverages. Because however we lay it out and however we want to present it, there are some key coverage differences and advantages in both systems based on the needs of the people that we visit with. We are seeing, as I mentioned before, a ton more Medicare Advantage plans than there have been in the past. I got to tell you, I've been in this segment of the Medicare world 30 years almost now, 40 some in the insurance world. There was a time period where these plans went away, in a manner of speaking, where funding was cut back to such a degree that different options may have been more advantageous for an individual. Pendulum swung there a little bit now. So you see many of the Medicare Advantage plans where they may be under fire in certain areas based on publicity or network or whatever it happens to be, but they are some of the leading organizations that come out with benefits to help with social determinant of health needs. Some things that may be a tad non-medical that affect medical circumstances. And because of the competition that's ramped up in this area, we're seeing more and more programs made available to people that can really help them in ways that we may not have thought of as standard coverages in the past. When it boils down to how's it affect us? Well, commissions on Medicare Advantage and PDP plans, those Part D programs, the max is set by the government. And most of the carriers that are out there realize that they can pay a commission up to that amount. They go for the max. They're looking for competitive pieces. So there are different things that they can't do when it comes to bonus programs or other things like that. But that commission is based on where an individual is. And has that person been in a program in the past as well? We also have to take into account those extra programs that we talked about where people need more dental coverage or whatever it is. How do those ancillary plans pay commissions, and how does that come into play? And in each of those circumstances, these choices between Medicare Advantage and MedSups, both in many cases, need ancillary program assistance as well. But what's a MedSup pay? And the big question in a lot of this is, when do you get paid? For those of you that have been active in the Medicare world, you realize that a plan that you wrote in October, that's effective the 1st of January for a Medicare Advantage or a PDP program, you don't get paid on that until after the 1st of January. MedSups, you're normally paid when that comes into effect as a program that's already been through underwriting or whatever it happens to be. So we need to look at our payer mix when it comes to this as well, and realize that we may be looking to pursue different segments of the market based on our economic need as well. We need to make certain that we do what's best for our prospects and clients, but we have to take into account, how can we afford to do that? We have different ways, different tools that Premier has put together that helps you with cross-selling and the ways of approaching these different segments in the market. These are available through your agent success manager, your marketer within Premier. They're on our websites as well. So these are available as additional tools to get more ideas as to how can I become adept at the overall design of a benefit package based on an individual circumstance. So look for these and make certain that you take advantage of these tools in addition to all that other stuff I already showed you available from the government and the carriers. Why would you want to do this through Premier? Well, let me check really quick and make certain that I may have covered all the questions that have come into play so far. And it appears so. But there are different reasons why you want to do this through Premier Marketing. You have the expertise of the folks that you visit with through our offices, a huge organization that are there, but we make it as easy as possible for you to contract electronically and cover yourself financially with discounted errors and admissions coverage as an agent contracted with our organization. Now keep this in mind, this is a program you own, so it's not just necessarily for programs you market through Premier Marketing. It's a requirement with the insurance companies. We want to make certain that you're able to address that issue with every program that you offer. We do also offer a discounting on continuing education to keep your license in play through CE bundles through our association with WebCE. And you even have a way of adding to your own benefit package through a modified guarantee issue disability income program on yourself, on which you are paid a commission because you manage your own benefit package as an independent agent. Much as where today's presentation is being recorded, past presentations have been as well. They are available on our website and on our YouTube channel, but it gives you the opportunity to go in and educate yourself, become familiar with whatever the terminology you want to do 24/7, all available through those websites and the recordings that are being done on your behalf. We do offer a tremendous tool that helps you in this area in marketing Medicare programs, other programs aimed at this population as well, through our Medicare Center, where you've got a single login for multiple coding engines, where you can do side-by-side plan comparisons and collect the information you need to be compliant and store it for that 10-year period, and help you market through personal URLs, microsites, where a person can come and investigate the different programs you offer, select one, enroll one through the site. Since it's pointed to you, that's your client, that's your commission. It does have a client management, a contact management system, a CRM that's part of it. That includes designations of switcher tags. So for folks that you have in there that may be more likely to change coverage, which means you can tailor your approach to those individuals by doing an overall review of different opportunities in that area on an annual basis, or perhaps even a review of that specific program that you have with that individual in that particular time and space. Lead Center, we'll talk about in a moment. Learning Center resources are ways to help us get better at what we do. So review of talking points with folks when it comes to call scripts or different things of that nature. So we are as adept at the programs that we offer as possible, because it's not just getting in front of people, it's closing them and making certain that we're able to do so either at our desktop or through a mobile application, which is available as part of the Medicare Center program. Keep in mind, in the vernacular of J.J. Walker, these are available without cost to our contracted agents. It's free, all available in that manner that can be such a difference when it comes to your success in not only marketing, but marketing compliantly and doing so consistently. There are certain programs that do offer additional incentives to you based on production. These are generally Medicare supplement or ancillary programs, or things that aren't Medicare Advantage and PDP plans, because as I mentioned, max comp for those are set. But those other programs may give you marketing dollars if you sell so many med subs a month, or a combination of dental, vision, hearing programs, whatever it may happen to be. Additional dollars in your pocket may help you qualify for carrier trips and incentive programs that we offer as well. It includes the producer convention that's back as part of Premier as well. We want to make certain that we can get you in front of as many people as possible. So we're doing so through different ways, different avenues we look to do that. Contact lists are available to you. If you're one of those that still like to smile and dial, God bless you. We have a list available to you at low or no cost, butted up against do not call. So you can do so compliantly, unlike the 3 calls I already took today asking for my approval for them to work on my behalf for my Medicare programs. Ding, I'm not on Medicare yet. So we want to make certain that you do things compliantly and that you're adept at the opportunities that are there before you. So if you've worked the retail marketing programs through Walmart or one of the carrier sponsored programs, how can you maximize the value of that, not only during the open enrollment period, the annual election period, but throughout the year by continuing that association and that relationship? How do you reach into the community for other centers of influence, including faith-based organizations or the providers that deliver upon the care of the programs that we're offering? How can we work most efficiently with those people? Those are recorded and made available in our video libraries as well. There are carriers that will help you with different prospects, but it's normally a quid pro quo situation. It's a you scratch your back, you scratch my back, I'll scratch yours type of thing. So if you have relationships with different carriers, they may have leads to help you. And that's based on your relationship in many circumstances with local carrier agent managers. We want to make certain that we help facilitate that relationship as well. We do have internet lead programs outside of the Medicare Center's Lead Center, direct mail support as well. Talk about Lead Center in a second, a T65 locator, and a reminder program that makes us be more effective in taking one lead and having it go forth and multiply through referrals and working that system. The mail program is a discount program based on activity, based on production. You can qualify for it twice through our organization, where you have a discounted price on mail that you direct the campaign through vetted lead vendors that have systems that help you get the responses back as quickly as possible and help generate those responses through compliant outreach. You want to make certain the letters aren't offering half of the Pacific Ocean to someone if they respond to a letter. These guys, that's obviously an exaggeration, but These folks are great to work with. They have the systems that can make you very effective in working direct mail consistently, because this is like an exercise program. You do it once, you might see something maybe, but you feel the pain. You do it consistently, that's where you reap the reward. We do also have a direct mail response program through one of our platform partners, where you can fill your calendar based on direct mail responses that have not been spoken with in the past. The cost does change through certain times of the year and through different areas, but it's a great way to fill your calendar for folks that have raised their hand saying, give me some of that. The Internet Lead Programs is a Facebook program, one set up for Final Expense and one set up for Medicare leads. One of the things that really has been influenced in this area is the fact we have become a microwave society. So many folks, if they ask for information through the internet, through Facebook, well, they want a response pretty quickly. One of my friends, she got a response at 2 o'clock in the morning. When she replied to him at 6 o'clock in the morning, they'd already gone someplace else. So if you're working the World Wide Web, we want to be aware of the fact that the timetable for response and serving that population might be greatly accelerated. Lead Center, this is a program within Medicare Center where you can buy responses brought about through different systems. Might be garnered off the internet, might be direct mail, whatever it happens to be, but fresh campaigns that could be, in some cases, a live transfer or additional pieces of information put in our CRM in Medicare Center. The live transfers are as well, but it's an opportunity for you to purchase leads based on your budget and the area you wish to pursue and the manner in which you want to pursue it. You control that lead flow, all done at a very reasonable cost and through a system that helps you maximize the value of the leads that you've obtained. That T65 locator, well, that gives you an opportunity to download a program on your smartphone, on your desktop, on your smart device, whatever it happens to be, register for it. You get verified that you have programs with us, available to you once again, free, and it maps out where people are based on the parameters that you select in this area. So it can be a big difference for you if you're in the field, you stack appointments, someone cancels, well, I can door knock for dental programs for Final Expense. You can't for Medicare Advantage or PDP programs. And if you do so for MedSup, you get in the gray areas a whole bunch. But it's a great way for you then to make certain that you realize the market you selected has people in it that really need your help and a way to approach them. That referral program, well, that not only pertains to people during the selling process, but it's a great way for us to go back and keep our book of business engaged and market to them periodically as well. You know, Mr. Prospect, I appreciate the confidence you had in me and working with me during the open enrollment period for your medical coverage. I've got a great dental program that's been made available to us in our area. Do you know of other people that this might help? Well, a lot of times the response is, yeah, me. So a great way to engage your book and grow a market through just some very simple wording. We do all this because we want your business. We want to be referable to you, and we want to make certain that you realize the basics of Medicare is something that you need as part of your personal marketing plan, because it can affect so many of the avenues you can take to market in the area. And it takes some time sometimes to be very comfortable with some of the information, but it's not rocket science. You have the resources that are made available to you in this area. You put it as part of your program and you move forward with it. That's why our folks with Premier Marketing can be such of a big help to you, because we're experienced in that area and we want to make certain that we share that experience with you. We do all this because we recognize people that come on these programs have done business with us in the past, and we need to thank them for that business. So if you've done business with Premier in the past, thank you. Sincerely appreciate that opportunity to do business with you and the opportunity to strengthen and grow that relationship in the near future. For those of you that might be viewing this that haven't done any business with Premier, we thank you for the opportunity to discuss doing so in the future. But for everyone, we want to thank you for the investment of your time in viewing this presentation. We realize that is your most precious commodity, and we thank you for investing part of it with us here today. So all that said and done, one quick check. No question, nothing I haven't addressed. I want to thank you for coming on with us today. And until we're able to visit with you in the very near future, I wish you good selling. Thanks so much. We'll talk to you soon.